The Delta variant spreading across the country, and now it accounts for more than 80% of all new cases in 4 separate states: Kansas, Arkansas, Connecticut, and Missouri. That's according to data from the Scripps research. The Delta variant starting to strain some of the healthcare systems in America, too. For instance, a hospital in Springfield, Missouri had to borrow ventilators over the weekend because of a sudden spike in COVID patients there. Today, President Biden outlined new plans to persuade more Americans to get vaccinated after falling short of his goal of getting 70% of adults at least one shot by 4th of July.
Millions of Americans are still unvaccinated and unprotected. And because of that, their communities are at risk, their friends are at risk, the people that they care about are at risk. This is an even bigger concern because of the Delta variant.
Meantime, new data from Israel suggests Pfizer's vaccine is less effective at protecting against infections caused by the Delta variant. CNBC's Meg Terrell covers health and science for us. Meg, could you break down the data for us?
Yeah, Shep, this report from Israel's Ministry of Health looked at the Pfizer vaccine's protection going back to early June. It found that it prevented 64% of infections and mild disease. Now, this was during a time when the Delta variant was spreading there. Importantly, though, it also reported 93% protection against hospitalizations and severe disease. So while that 64% is certainly lower than we've seen in some other studies of how well the vaccines hold up against Delta, and some are questioning the methodology of this report, experts I've been speaking with say the most important thing for a vaccine to do is to keep you out of the hospital and prevent death from COVID. And on those counts, this update is still really reassuring. We also reached out to Pfizer, and they say while they can't comment on unpublished data, they cited a number of studies suggesting their vaccine will continue to protect against the variants. Undoubtedly, this will raise questions about whether we need booster shots and when. The opinions there are mixed too, but vaccine public health experts say if you're making decisions about boosters based on protection from severe disease, you don't need one because of this update, but the conversation might be different if you're looking at trying to prevent transmission or mild disease, Shep.
Interesting. You know, we've been hearing more about another variant. They call it Lambda. What do you know about it? Should we be concerned? Give us the details.
Yeah, so Lambda is considered a variant of interest by the World Health Organization, not yet one of concern, and it's circulating predominantly in Peru and other South American countries. I spoke with NYU's Dr. Ned Landau today, who just published a paper, though not yet peer-reviewed, on Lambda, and he notes it shares a similar mutation with the Delta variant that likely makes it more transmissible. The good news, though, his group looked at how well the Pfizer and Moderna vaccines are likely to do against the Lambda variant, and found they should remain protective. In fact, he noted, quote, there are no variants that so far can escape those vaccines. Shep?
That is the best news of the day.